from one of the 76 member states or signatory parties to the additional protocol.
Our organization is calling for an independent fact-finding investigation to ascertain the truth about the events that led to the killing of our colleagues and patients by U.S. airstrikes on one of our hospitals in Kunduz, Afghanistan. On Saturday morning, October 3rd, Doctors Without Borders patients and staff killed in Kunduz joined the countless number of people who have been killed around the world in conflict zones and referred to as collateral damage or as an inevitable consequence of war. There are no mistakes under international humanitarian law. The attack on the MSF hospital in Kunduz was the biggest loss of life for our organization in an airstrike. Tens of thousands of people in Kunduz can no longer receive medical care now when they need it most. Today we say enough. Even war has rules. In Kunduz, our patients burned in their beds. Our doctors, nurses, and other staff were killed as they worked. Our colleagues had to operate on each other. One of our doctors died on an improvised operating table, an office desk, while his colleagues tried to save his life. Today we pay tribute to those who died in this abhorrent attack, and we pay tribute to those Doctors Without Borders staff who, while watching their colleagues die and with their hospital still on fire, carried on treating the wounded. This was not just an attack on our hospital, it was an attack on the Geneva Conventions. This cannot be tolerated. These conventions govern the rules of war and were established to protect civilians in conflict, including patients, medical workers, and facilities. They bring some humanity into what is otherwise an inhumane situation. The Geneva Conventions are not just an abstract legal framework. They are the difference between life and death for medical teams on the front line. They are what allow patients to access our health facilities safely and what allows us to provide health care without being targeted. The facts and circumstances of this attack must be investigated independently and impartially, particularly given the inconsistencies in the U.S. and Afghan accounts of what happened over recent days. We cannot rely only on internal military investigations by the U.S., NATO, and Afghan forces. Today we've announced that we're seeking an investigation into the Kunduz attack by the International Humanitarian Fact-Finding Commission. We are calling on President Obama to consent to the Fact-Finding Commission. Doing so will send a powerful signal of the U.S. government's commitment to and respect for international humanitarian law and the rules of war. This is not only about the deaths of our staff and patients in Kunduz, it is about the safety and security of our medical teams around the world working in conflict zones.
If you have any other questions, you can see me or my colleague Tim Schenk,